On Sunday, the Labour Party unveiled a significant election policy aimed at incentivizing general practitioner (GP) clinics to offer bulk billing to every patient. This ambitious plan represents a substantial commitment to improving healthcare accessibility for all Australians. The policy follows the Albanese government's 2023 initiative, which tripled the bulk billing incentive for pensioners, concession card holders, and families with children. However, recent data revealed a concerning trend. Bulk billing rates have been declining for patients who do not qualify for these concessions. This highlights a persistent challenge in ensuring equitable access to affordable healthcare across the population. The coalition responded swiftly, pledging to match the Labour Party's $8.5 billion plan on a dollar-for-dollar basis, underscoring the bipartisan recognition of the critical importance of this issue. The political landscape surrounding healthcare affordability is clearly defined, with both major parties vying to present the most effective solution to address the growing concerns surrounding bulk billing access. Health Minister Mark Butler defended the government's policy on Monday, asserting that their internal modeling unequivocally demonstrates that the vast majority of GP practices would experience significant benefits by extending their bulk billing services. He confidently stated that the government's projection of 9 out of 10 consultations being bulk billed by 2030 is a conservative estimate, reflecting a cautious yet optimistic outlook on the policy's potential impact. This optimistic projection hinges on the assumption that the increased financial incentives will indeed motivate a sufficient number of GP practices to adopt the extended bulk billing model. Dr. Elizabeth Devaney, the head of the Consumers Health Forum of Australia, offered further support for the policy, emphasizing that doubling the Medicare bulk billing rate for standard consultations is a crucial step towards addressing the pervasive issue of limited bulk billing access, particularly for patients residing in rural and remote areas. These areas often face significant barriers to accessing healthcare services, and the lack of readily available bulk billing options exacerbates this problem. Dr. Devaney's endorsement underscores the policy's potential to significantly improve health outcomes for vulnerable populations residing in geographically disadvantaged areas. The policy's success will depend on overcoming several challenges, including securing the participation of a sufficient number of GP practices and effectively managing the increased financial demands on the healthcare system. The long-term sustainability of the policy and its ability to achieve its ambitious goals will require careful monitoring and evaluation. Furthermore, addressing the underlying structural issues contributing to declining bulk billing rates will be essential to ensure the policy's enduring impact. The debate continues, but the focus remains firmly on ensuring affordable and accessible healthcare for all Australians, regardless of their socioeconomic circumstances or geographic location. The government's commitment, backed by substantial financial investment, signifies a significant attempt to tackle a persistent and complex issue within the Australian healthcare system. The impact of this policy will be keenly observed in the coming years, as it promises to reshape the landscape of healthcare access across the nation. The success or failure of this policy will have far-reaching consequences for the health and well-being of millions of Australians.